There are three kinds of interactions in CliniSpace. Basic interactions is the first one, and it has to do with these buttons at the bottom of the screen. The first one is text chat, and when you click on that, it pops up a window that looks like this. You enter what you want to say by typing into the white box, and it will show up here as a conversation. The other one, the contacts button, tells you who else is in the world with you. And in this particular case, there's one other person by the name of John. Voice chat is about communicating using your headset and microphone. We don't usually use this disabled enabled function, but you may want to use the mute button if you are having echo in your conversation. When the voice chat is actually working, the name that pops up above your head, which you're not seeing right now, will be outlined with a blue glow. If there's no blue glow, your voice chat is not working and other people are not hearing you and you're not hearing them. The other buttons on this side are less important. The only one you might be interested in is this one, which is about showing or hiding the name that shows up above your head. The second type of interaction is called clinical interactions, and it has to do with all of the interactive objects in the room. Let me begin with the first one that has to do with the patient. At the bottom of your screen, you have a patient menu, and when you click on it, you get a menu that allows you to observe the patient, talk with them, order tests, give medication. Please note the down arrow. When you click on that, then you will have more menus further down. The other important ones that have to do directly with the patient have to do with this magnifying glass, which I'll talk about later, and the stethoscope for auscultation. Looking around the room, starting on this side, we have on the counter a glove box that allows you to wear gloves, a phone that allows you to call different people. In the closet above, you have supplies like the thermometer, glucometer, catheters. On the wall here, you have the ability to hide and show the monitor. The headboard gives you access to the blood pressure cuff, the pulse oximeter, and very importantly, the airway equipment to put on the mask and the cannula. The IV stand has a lot of capabilities. You click on the IV stand, and if there's a bag already hanging on it, you can click on the bag and remove it or just stop delivering the fluid. If you click on the stand itself, you get the ability to connect the IV supplies through the IV supplies, give blood, fluids, cryoprecipitate, and very importantly, give medication via the IV. Please note when this menu comes up, you will have a little yellow arrow allowing you access to the lower part of the menu, which does not show up when you just click on the IV stand itself. The computer here on the side by the window gives access to the electronic medical record, which itself has a lot of information by clicking on the tabs on the left, beginning with the presenting complaint, the medical history, then you get the orders, you can see what has been done, and you can take notes. Lastly, on the bed itself, clicking on the bed allows you to change bed angle, the angle of the head of the bed, or to raise or lower the rails. And on the side of the bed hanging here is the urinary bag for the Foley catheter. So you can click on the bag and it will tell you what rate the urine is flowing. The third kind of interaction is patient interaction. And the way you get to it is by choosing this magnifying glass at the bottom. And clicking on it brings up this image that allows you to choose what exactly you want to look at or perhaps you want to do a full top-down view. In the example here, you're actually seeing the full top-down view. You can choose to examine any part from head to toe. If you choose the head, you get a menu that gives you both the specific inspection of the head, HEENT, or systemic examinations like the neurological, the level of consciousness, or overall look of the hair, skin, and nails. If the person is wearing a mask or a cannula, clicking on that allows you to set the airflow. So you would click on set oxygen flow and it would give you the different rates that you can set. Clicking on the chest, you get the lung function. So you can inspect the lung. If you click on auscultate, it will tell you to drag the stethoscope, which is here. You can grab it and then drag it over to the chest. If you click on respiratory rate, it will actually tell you the rate of breathing, which is also available on the monitor. Inspecting the skin is interesting because if there is imagery attached to this patient, you will actually see what the skin looks like, whether there's a rash, whether it's flushed, pale. You should note that right in the middle of the chest, you can find where the heart is. It'll pop up as a circle. And if you click on that, you get the specific menu for the heart. And auscultating the heart brings up a little diagram that allows you to auscultate on different portions of the heart. Other things of interest, here is the IV cannula, and clicking on that allows you to choose to remove the cannula, set it wide open, and other functions. The arm allows you to inspect the arms. If you click on the blood pressure cuff, if you've attached it and it's visible, you can actually remove the cuff. If you click on the wristband, then it gives you the identity of the patient, and this is important as a patient safety item. By the way, if these are hard to see, then go ahead and use this little diagram to make the arm zoom up, and then you can very easily access these objects. The third object in the arm here on the left arm is the pulse oximeter, which brings up the ability to look at the SpO2, even if you don't have the monitor on. Lastly, you can examine the legs, and specifically you could even go to the thigh or make a specific examination of the knee. I'm just attaching her blood pressure cuff so we can check her blood pressure. It is very low, doctor. It's the 90/38 right now, and her respiratory rate is really high. It is 34 breaths per minute. All right, attaching the pulse oximeter, and okay, looking at the monitor, her oxygen is 92%. Her saturation is low, not terribly low, but it's low. To auscultate, I will need to drag the stethoscope to her lungs, so I will do that. So I'm grabbing the stethoscope and moving it to her lungs, and right superior, right middle, left superior, left lobe. All right, dragging the stethoscope to the heart, checking the different points on the heart. Okay, checking the electronic health record on the computer. She's presenting with general malaise, lethargy, abdominal pain in the stomach and lower abdomen. Do you want me to check the orders? Oh, yes, it does say so. Clindamycin and gentamicin, 600 milligrams clindamycin and 5 milligram per kilogram gentamicin. Doesn't look like it's been given. Yeah. Okay, start checking the IV stand. So, giving normal saline at 250 milliliters per hour. I've just hung up the bag and I can go get the antibiotics from the medication cart and come back. Here's the medication cart. I choose patient 2 and I see the medications. Um, yes, here's the antibiotic. So I will uh, pick up the clindamycin and gentamicin. I click on the pickup medication and then I click on carry to patient room. So now it's basically in my pocket and then I turn around. The IV, so I'm bringing up the IV menu and clicking on the down arrow to reach the medication menu. Medication via IV and then antibiotics. I select that and it says clindamycin and gentamicin, which I brought back from the medication cart. And now I have given the antibiotic. Clicking on the headboard um, and selecting airway equipment, and then I'm selecting the oxygen mask, and we now have an oxygen mask on her. And when I click on the oxygen mask, I can set the oxygen flow 10 liters per minute. I've now given oxygen at the rate of 10 liters per minute. Doctor, the vital signs are actually getting better. The temperature has come down substantially, 98.7, and oxygen is improving. It's now 94%. Uh, Respiratory rate is coming down, 31. She's breathing a little better. Um, and the heart rate is at 135, so it's still a little high. Blood pressure is improving slowly. Systolic is improving well. Diastolic is still low at 38.